And as the opioid crisis continues here in Colorado, the federal government is now taking additional steps toward making a life-saving antidote more accessible. This week, the FDA approved naloxone for over-the-counter use for the first time.
9 News reporter Darius Johnson joins us in studio. And Darius, before this, the drug was technically only available via prescription.
Hey there, Jordan and Corey. You either needed a prescription or you needed to go to a substance abuse clinic to get this antidote for opioid overdoses. Although some states created workarounds, like right here in Colorado, our state had a free program offering naloxone, better known by the brand name Narcan, to anyone who signed up for it. Right now, drug overdoses are the leading cause of accidental deaths in the United States, and according to the Centers for Disease Control and Prevention, more than 107,000 people died of an accidental drug overdose in 2021, and more than 80,000 of those deaths involved opioids. That same year, about 1.2 million doses of naloxone were dispensed by retail pharmacies. The hope is that this will now help improve access to naloxone and reduce the risk for overdose deaths. Our 9 Health expert says getting it into people's hands is just one part of it. The rollout also requires some education.
But now we need to first educate people how to use it. And that means not just using it in the acute setting, but knowing when to use it and knowing how long it lasts. So it's a quick little squirt in the nose, so pretty easy to use, very straightforward. Even children can do it, actually, teenagers and older children.
One other thing that Dr. Coley also mentioned in that interview, she hopes that they also try to roll out some smaller doses for children, because we have seen a lot more of those incidents recently. FDA officials say naloxone could now be sold in convenience stores, grocery stores, and even vending machines. However, it likely won't be available until summer because the company that makes it needs time for the rollout, sorting out the cost to see if insurance companies will pick it up and to see if other manufacturers want to jump on board. Again, doctors say all of this comes right on time as the U.S. has started to see an uptick in both teenagers and children accidentally overdosing and dying. Jordan and Corey.
Well, we know if you give Narcan to someone who didn't have fentanyl, it's not going to hurt them. So this seems like kind of a no-brainer.
Yeah, and not just fentanyl, but all of the other opioids and all the other drugs that we've seen laced on the market recently.
Yeah. All right, Darius, thank you.